Hi everyone, I just wanted to review some info from last week and then this upcoming week to come. So last week in week 6 we had talked about quality, so quality improvement, process improvement, and then also some information on operations. So hopefully you got a good feel for the quality management function in healthcare. It's become increasingly more and more important over time. I think back to when I started in healthcare, and we had a quality person. I don't even think it was their full-time job, but we had some quality improvement activities ongoing, specifically TQM, which we had looked at last week. We had a TQM program, but it was minimal. And now you have entire departments. You have vice president level positions focused on quality. It really, there's been a major shift in the industry to focus on quality healthcare and therefore constant improvement, quality improvement, patient safety in our organizations. So that was our work for last week. Also talked a little bit about operations. And operations is such a broad topic. But so you can be in operations and you can be, a clinical manager, you can be like someone like a service line administrator, a practice administrator. You can be in a specialty area like HR or IT or finance. They're all involved in operations. So it's a very broad topic, but operations management is obviously a crucial part of any healthcare organization, making sure that there's efficiency and effectiveness in those areas. So week 7 is this is our last full week of class. Remember that in week 8 it's a short week, so just be prepared for that with regard to your final exam, etc. This week we're going to talk about financial management and kind of the elements of healthcare that are related to finance. So things like billing and coding, reimbursement, spending on healthcare, economic issues in healthcare, etc. So lots of stuff this week in the classroom with regard to economics and spending in healthcare, etc. You'll also find a final exam blueprint so you can start your studying up there as well. We do have a discussion this week about the elements of healthcare spending that are out of control in our country. We've talked about, probably over the past several weeks, we've talked about how costs are higher here than they are in any other Western country, but our outcomes are much less than that. So how can we adjust these cost-related issues and deal with some of that for the future? So that's our discussion for this week. We do have a case study in the textbook on page 546. This is not a group case study. These are to be done individually. Then we have a quiz and then obviously this Edpuzzle. So let's take a look at the quiz questions from last week. First question, the definition of quality provided by the Institute of Medicine, or IOM, is the most widely accepted definition of healthcare quality. Which of the following are not parts of the definition? So the correct answer was they should provide value consistent with the cost structure of the healthcare organization. And that's not really part of the quality definition. You need to be providing value to all patients in your healthcare organization, not based on how much they pay you or how much the cost is, but a high value for their for what they pay for your services, meaning high quality services at all times. So it's not really based on or consistent with your cost structure. You need to be, whether you're charging someone $25 for a service or $2,500 for a service, or depending, regardless of the cost of that service to you as an organization, you still always need to be providing a high level of quality. So things like we see in these other elements, adhering to professional standards, consistent with clinical focus, all preferences of the healthcare providers for effectiveness, achieve desired health outcomes, for individuals and society overall. So those are all the kinds of things that we want to see in the quality, or we would see in the quality definition. Providing value, although we always want to provide our customers value, we would provide them value in healthcare, not necessarily based on our cost structure. So that's what's really deviating from the overall definition there is this notion of cost. Next one, the term effectiveness of clinical care can be addressed with which of the following questions? So we talked about last week effectiveness and efficiency. So effectiveness is about, are the right things being done? That's our correct answer here. So are the right things being done? That's what's making something effective. That's what's making the service or the treatment or whatever it happens to be effective. Is the provider doing the right things and therefore providing effective clinical care? When we think about efficiency, we're talking about, are things being done right? So kind of flip that question around, or that answer around a little bit. So efficiency is, are things being done right? Are services being done properly the first time so they don't have to be repeated? The patient doesn't require additional care based on misuse or negligence, those types of things. So effectiveness, are the right things being done? Efficiency, are things being done right? Next one, to err is human, examine the high rate of medical errors in U.S. hospitals. Such errors are due to which of the following? So as it talked about in the textbook, it talked about misuse, overuse, and underuse, and it talks about fraud and abuse in the textbook as well. But in this section, it specifically spoke to misuse with regard to the high rate of medical errors. So misuse is really negligence. When an organization or a person is negligent in their actions, not necessarily following the standards of clinical practice for whatever it is that is going on. So it could be negligent, it could be, gross negligence like performing a surgery on the wrong side or on the wrong patient, or it could simply be negligence on behalf of an organization. Maybe they have a patient that ends up falling because they're not noted as a fall risk, or they have a patient that ends up with an infection because their infection control practices are not up to par. So misuse is a broad term, but that is in the To Err is Human report, which was what really drove the quality movement in America. They found that misuse was really the root of the medical errors in U.S. hospitals overall. So that's all we have. Let's go back here. So if you have any questions on the work for this week, please let me know. But again, remember that this is our last full week in week 8, which is next week. We end on Friday, so plan for that with regard to your final exam, etc. That will be posted next week, and that's all I've got. So any questions, please just let me know. Thank you.